just to kind of give you a preview and a heads up, we're going to do some brief introductions here in just a moment. And then we have representatives from our qualitative RIIG who will be asking a few questions, and then we'll open it up to the audience for questions as well. So if you have questions that you're thinking, oh, I'm gonna forget my question, please feel free to put that in the chat. And we'll continue to kind of monitor the chat. And then if you don't mind, if you do have a question, if you don't mind raising your hand, that will just kind of help us to navigate who's asking questions. And then we'll call on you to have your question asked. So thank you again for joining us. Just to give a quick plug, again, we are part of Southern Nursing Research Society's Qualitative Research Interest and Implementation Group. So if you are interested in joining, if you're not a member of our qualitative RIIG, we certainly invite you to join us. I will put in the chat the link to all of the RIIGs with SNRS, and so certainly check that out. All right. So to get us started off, we're going to, again, kind of start off with some introductions. And so, Lisa, if you don't mind kicking us off with our introduction first.
I would be happy to. Hi, everyone. I am going to introduce Dr. Anna Bieber. Dr. Bieber is an Associate Dean for Faculty Development and an Associate Professor in the Research Education track at Johns Hopkins University School of Nursing. She serves as a steering committee member and the principal faculty in the Center for Equity and Aging at the JHU School of Nursing. Dr. Bieber's research focuses on aging with the goal of improving quality of life for older adults in long-term care settings. This is being accomplished by improving patient and family care, as well as affecting the policy for the long-term care staff. She is considered an international nursing leader in gerontological nursing and health services and an expert in community-based work. She strives to engage stakeholders such as the patients, including those with physical or cognitive dementias and impairments, their family members, and the staff, both the direct care workers and the administrators. So in this way, she's going to understand their experiences and design interventions in long-term care. We are delighted to have her join us today. I could go on, but I will let Dr. Bieber correct me if I missed anything, and we can continue on with introductions.
Great. Are we introducing everyone, or just should I get going?
Yeah, we'll introduce everyone first, and
Okay,
then
good.
we'll come back with questions. Yeah, but
Okay,
please,
good.
yeah, if there are things that you're like, oh yeah, and you should also know this about me, chime in and let us know. All right.
Okay.
So now we will go to Angeline, if you don't mind introducing them.
Yes. Hi, everyone. I will be introducing Dr. Bravo. So Dr. Lillian Bravo is currently an assistant professor at the University of Miami School of Nursing and Health Studies. Prior to University of Miami, Dr. Bravo received her Bachelor's of Science and PhD in Nursing from the University of North Carolina at Chapel Hill and completed the National Clinician Scholars Program Fellowship at the University of California, Los Angeles School of Medicine. Her program of research focuses on identifying culturally and contextually congruent risk and protective mechanisms in the development of self-injurious thoughts and behaviors, and developing youth-informed solutions to improve mental health support access for ethno-racially minoritized youth and young adults. Her long-term goal is to produce research that will inform timely, concrete changes in mental health care access for minoritized youth and young adults at risk for suicide. Thank you and welcome, Dr. Bravo.
Thank you for the introduction.
All right, and Vanessa.
Hi, everyone. I'm Vanessa. I'm going to be introducing Dr. Jane Everett. Dr. Everett is a registered nurse and action researcher passionate about qualitative approaches to inquiry. She is currently an investigator with the Qualitative and Health Experiences Research Lab at the University of Wisconsin-Madison. Dr. Everett strives to pursue research, practice, and advocacy collaborations that work towards improving person and care partner experiences of health and health care. Welcome, Dr. Jane Everett.
And Dauncey.
Yeah, hello everyone. I'm here to introduce Dr. Higinio Fernandez Sanchez. He's an assistant professor at UT Health Houston Cizik School of Nursing. His research focuses on the experiences of migrants from diverse background and the intersection of migration, global health policy, and social justice. Dr. Fernandez Sanchez's scholarly contribution includes 30 peer-reviewed articles across nursing and non-nursing journals. He's also recognized as a reviewer for esteemed journals like Lancet. He has, done outstanding work for migrant community that his effort has been recognized nationally and internationally. He was one of the 5 earlier nurse scientists selected for 2024 Emerging Nurse Researcher Scholar Award from Sigma Theta Tau Honor Society. He's also one of the national and community experts on HIV crisis affecting Latino community who was invited for a White House summit on September 2024. And more recently, he got the Early Career Investigator Award by SNRS that was actually just completed last month's conference. And he's also my colleague. So I am so excited to welcome Dr. Higinio. Welcome, Dr. Higinio. Thank you.
Excellent. Unfortunately, Dr. Patrina Sexton Topper is unable to join us today and sends her regards. She also said that if folks had questions, to please let us know. If you would like to learn more about her work specifically, we're also hoping that we can later invite her to join us, perhaps at a webinar in the future. But she does send her regards to everyone. All right, so with those introductions, we're going to go ahead now and transition to our discussion. We'll start with our representatives from the Qualitative RIIG who have prepared some questions, and we're just going to, again, go kind of alphabetically. So we'll start, Lisa, if you don't mind.
No, that's great. Hi again, everyone. My questions are, like Alicia said, pretty broad. I did base them on Dr. Bieber's work, so I'm asking her, but I'm also kind of opening the discussion, I think. Is that correct, Alicia? Great. Okay. Dr. Bieber, building community partnerships seems daunting for even experienced researchers, I think, to go out into the community and try to make partnerships and join with organizations that really have your population of interest. How did you build a network of community partnerships for your past or current projects?
Well, that's a great question. So I first wanted to say hello to everyone, and it's so great to see so many colleagues that I know, including colleagues and former students from UNC Chapel Hill. So you guys are warming my heart to see you there, and so it's so great to see you all, because I may be a little bit further in the north, but I'm still, part of UNC. So it's great to see you all. So thanks for that question. So I really, for people who know me, and I really take a very pragmatic approach to methods and how I approach research. And what I have done in my work is that I try to, from the outset of the work, is always have participant panel be a part of the work that I do. And so that means it's really having the people who will be affected by the work, and the people who will be users of the work be informing the work from the outset. And that doesn't necessarily mean that that could be the expert organizations. And some of that has gone through some of the service work that I do through my faculty role. So becoming involved in things like the National Center, getting to know people at the National Center for Assisted Living and some of those other types of organizations, but then also
You getting
building
oh yeah, because that's what Sirizawa was getting played. What Sirizawa?
building the at the outset of the research that the questions that you're asking, as well as the study that you're doing, is really a part of, is informed by your potential participants and the people that you want to change. So part of that would be is that I have residents and families and staff and assisted living that I work with that for the study that I just completed, we started off the study doing qualitative interviews. And then throughout the study, we would then recruit members from those interviews to be part of the panel that helped design the rest of the study. And those participants really have informed future work. They became part of our expert panel. And I think that that is starting out is really going from that early qualitative work and maintaining those relationships and being able to have those individuals stay as a part of your work. And then as the work grows, is that you bring in researchers, policymakers, experts in other areas, ombuds people. You know, I've just kind of accumulated contacts. But still, when I have these panels, it's the residents and the families and the staff who everyone wants to listen to. And so they really are brought on as experts. Yeah.
Okay, great. Thank you. That was really that completely answered my question.
Yeah, okay, good.
I know it's a big ask. You know, how did you build?
Yeah.
But I'm always so curious because when I was looking at your work for your intro, the levels that you have approached to get the results that you're getting, it just was really inspiring and exciting.
Yeah, and there's some researchers that would not have, let's say, assisted living residents and family members and staff all combined in the same group. Like they would, there's strengths and weaknesses to that. But I found a real strength in having the residents with everyone else, because when the residents speak, everyone else listens. And so there's a difference with what I'm doing that's different from doing like a focus group, right? So it's not about getting data from these individuals, it's about having them as an expert informing the research. And so I want to be clear about that, is that they are really there as an equal. Yeah.
Nice. Okay, thank you. Okay. Alicia, do I go into my
No, I was going to say we'll turn to Angeline now.
Okay.
Just to clarify, is this just for Dr. Bravo, or is it
Yes.
the other panelists? Okay, just for her. So my question in reading your work and reviewing your work is, what inspired your interest in doing qualitative work in marginalized communities?
Yeah, so I think like for a lot of us on the call, also I did want to say it's really great to see you, Dr. Bieber. She was who taught me everything I know about qual at UNC. But I would say like for a lot of us likely on the call, right, we think back to our early clinical experiences when thinking about our research questions, or perhaps our own lived experiences, right? And so for me, I worked as an inpatient psychiatric nurse on a child and adolescent unit. And I saw a recurring pattern, right, of some of the youth that were at highest risk for, severe presentations in terms of suicidal ideation and suicide attempts. We unfortunately kept seeing back. Into the inpatient setting due to lack of follow-up with outpatient providers. And these youth were primarily from Black and Hispanic communities. And so for me, that prompted kind of the interest. And let's focus in on what's going on in this group that perhaps we're seeing a limited connection to outpatient care that can help to reduce the suicide risk. So that's kind of how broadly my interests in working with marginalized or minoritized populations came to be in my work, and then kind of how I decided to apply qualitative methods that actually came after my time in the PhD program. During my PhD program, I actually did a secondary data analysis, and I really was focused on developing my quantitative skill set. And I developed my qualitative skill set through other projects with mentors, with Alasia, who's on this call. Um, but then, when reviewing the findings of my work for my dissertation, I was like, okay, like, we found, I think Black and Hispanic youth were more likely to receive care in school-based health clinics, and in primary care settings, as opposed to things like, going to an outpatient therapist, for example. But those numbers can only tell you so much, right? But trying to understand the why behind those numbers. For me and my postdoc, I knew I really wanted to explore that further through a qualitative study to particularly understand sort of the pathway from initially identifying a risk in terms of suicidal thoughts and behaviors from the perspectives of these individuals, particularly Latina young adults, and then following their process from, deciding which resources to tap into, what their experiences were like in those resources, and then what led them to kind of keep going, and their recovery process. And that's something that simply, understanding who's at greater odds to attend which type of service can't tell you. So I think that's kind of how I integrated those interests, both first understanding in marginalized communities where that interest came to be, and then applying qualitative methods to better understand the problems at hand.
Thank you. That was a great response. I like learning about your journey from bedside to present day and how kind of as you mature as a researcher, you're adding more skills, like starting from quantitative and adding qualitative as different questions arose. So thank you.
Yeah.
Vanessa?
Yes. So we often say that equity is the foundation for healthcare. My question to you, Dr. Everett, is in advancing equitable person-centered care within a family and community health settings, what implementation framework or outcome metrics have you found most effective in operationalizing equity beyond just patient satisfaction, particularly in addressing structural drivers of inequity?
Yeah, wonderful question, and so important. Thank you all so much for being here. It's nice to spend some time with everyone. So my work really focuses on people's experiences, and I think when I think about the outcome metrics to understand equity, I always sort of, from a very biased, mostly qualitative person perspective, go back to really trying to understand those experiences. So we think a lot about sort of how do we understand equity from people's perspectives, and have worked with a really wonderful community advisory group on the development of some interview questions about sort of who people are, as well as how they feel like they're perceived in healthcare, and the ways that these are often different. And so thinking about how do we sort of build those types of questions into spaces where they might not be asked. So currently working on some projects about ageism, both older adults and younger adults, and thinking about, how can clinicians kind of help to understand people's past experiences with some of these structural forces in healthcare, and then using the qualitative questions to kind of follow up. We also do some work with short, open-ended questions on surveys. And so we always ask people about experiences they've had with sort of the ways that they identify. And that elucidates a number of actionable ideas that folks have for improving health equity in the healthcare system. So I think different approaches, but always kind of going back and hearing directly from people about their experience.
Thank you so much for answering that. I think that's so very important, especially when you're talking with different patients and trying to get some feedback from them as well.
Yeah, I think it is my turn, right, Alicia? Okay, so this question is to Dr. Higinio. I think it is a very relevant question nowadays. And one of the things I really want to know is, I mean, you are doing wonderful work among migrant population. So one of the things I want to ask you is, what strategies do you employ when you engage in research with migrant population, especially with recruitment, rapport building, establishing trust, especially that they may fear disclosure related to their immigration or legal status?
Yeah, thank you for that question. The short answer is a lot of things. And I will say that I tend to spend a lot of time in the field, and my community engagement, I would say that 70% of that time is non-research related, which I think is very important. And the rest of the time is collecting data and doing research stuff. But that 70% is a lot of time. And speaking of that, tomorrow I'll be out for a 3-hour evening talk using body mapping to engage with the community, non-research related. So I think that's one of the things I tend to do. I like to show up for things that are not necessarily on my agenda, but are on my partner's agendas, and they want me to come out. And maybe sometime I don't have to speak at the events, but people see you, people see me, and the community at large. I try to gain trust from them. And so in our last project, we were able to collect data of 200 participants, immigrants, newcomer immigrants, and 100 farm workers. And I think that's, I think my CFAR was really like shocked, like, how can you do that at this time? So I was like, well, because I spent a lot of time in the community. Of course, I'm able to do that now because I'm in an early stage. I am aware that as my career progresses, that may be a little tighter in terms of time, how much time I spent out in the field. But I do ethnographic work. So my global work in Mexico, I was there for 3 weeks. I stayed in the shelters and the migrant shelters. So that's another thing that I like to do, like ethnographic observation. And I tend to use non-traditional ways of collecting data. So, I use body mapping, which is, they're all sort of grounded in critical social justice, equity focus methods, which can include, again, body mapping, conversation cafes, which we are now proposing something called Cafecito for Latino immigrants. And other methods that we use to collect our data. So those are some of the ways that I, am able to do. Of course, I get informed consent waived by our IRB, so I never collect any identifiers. Those are more common things that we tend to do regardless of the time that we're in. And also, we just published a paper that talks about that I can share in the chat. And I co-author that with community partners. So I tend to do that. I publish along with my community partners. We co-present at conferences. So there's one coming up at Latinx, and we tend to go together. Of course, there's a lot of constraints with resources, right? So we can't always do it. But whenever we can, we try to not just share the space like research related, but also go beyond the non-traditional ways of engagement. So again, it does take a lot of time. I mean, I've been in this role for 3 years, and I've been doing a lot of community work here in Houston, in particular, because I did grow up in Texas, but not in Houston. And so going out to the clinics and the nonprofits and showing up to their spaces, it has been crucial for the work that I do.
That's wonderful. You are one of the researchers who we say, fully immersed in qualitative research. You said you're spending time with them and, 70% of time, that's quite a bit of time. Yeah, but like I can see how you can gain the trust of the participants. And also you are engaging the community partners. Presentation, publication. So you do get a lot of help from them, once they see you as a true partner. That's wonderful. Thank you.
All right, so now we're going to kind of open it up to the audience. I believe there were some questions that might have popped up in the chat, and it looks like Dr. Bieber was able to answer that question in the chat. So if folks have their chat, they can take a look at that. But are there other questions that have come up, or questions from our audience? If you don't mind just raising your hand, or you might be able to come off mute. There's a lot of pages, so I may miss your hand. So feel free to come off mute.
Yeah.
There's a quick post by Faith. I like the idea of chat cafe, just to make that statement to everybody.
Yeah, so we call it Conversation Cafe or World Cafe, right? We have different names for it, right, Dr. Higinio?
So if you look in the literature, you will find about conversation cafes and world cafes. But we are proposing something called Cafecito that's grounded in similar principles, but adds concepts of power and social justice that are not in the traditional conversation cafe. And the paper's under review now, so hopefully we can get it out soon. But I'm sharing now the one that we just published with our community partner that's on best practices during challenging times.
Do you want to go with the second round of questions or?
Yeah. I just want to give one more second. Was there anyone else in the audience who had a question that they wanted to raise?
Yes, if I can have one moment to ask again. I apologize if I'm butchering your name, Dr. Higinio Fernandez. I was hoping you could talk a little bit more about the non-monetary ways that you've worked to access your population within your recruitment. I'm a doctoral student and also working on a shoestring trying to get my dissertation completed. And it would be interesting to hear a little bit more about ways that you've sought to be a support to this community without necessarily working through the financial aspects of it.
Mm-hmm. That's really important, especially for a PhD student. Yeah, so I think again is a lot of showing up for them and not. I have this philosophy of always giving before I ask. And so if I'm asking for a letter of support, most of the time I've already given something to them. And it's not always money. It's sometimes they want me to go talk to them about, I work with HIV populations and human trafficking. So sometimes they want me to come out and talk to them in lay terms. How do we prevent these conditions? And so I also have advisory committees. And I know someone else had mentioned that. I tend to have an advisory committee per project. And so if because sometimes like the age is different. I tend to work with youth, young adults, so 18 to 25. But now I have a funded project that I'm working with people aging with HIV. So if I use that same advisory committee, they won't give me the same insights. And they're wonderful because they will, a lot of the things we do is how we frame the question. So we want to make sure that the way we're asking the question is not harmful. And be very aware of the language and how we approach in general. So my goal has been to, yes, build strong community partnerships, but also have go a step further for the community at large to know me. And so I know I've been successful when I show up in the community and people start calling me Eugenio instead of Dr. Fernandez. And I'm like, yes, that means I'm doing my job well. because it's really hard for people to not call you, you know, Dr. Fernandez and that sort of stuff, right? But if you just get people who come, so for instance, I'm part of one of my strongest community partners. It's a nonprofit that provides free and low cost services for sexual health and mental health. And so, yes, I want to be partners with the people working there, but also with the people getting their services there, if that makes sense. So it's being seen. People recognize me. Well, to be fair, I'm also highly active on social media, and that has also been very helpful. I'm on LinkedIn, but also Instagram and Facebook, and I share all sorts of things. If you guys look me up on Instagram, you will see that I engage with, which is sort of like my advocacy activism work that I do that goes along with my research. So that has been really successful as well, social media.
I see that Faith, I believe, has a question. Thank you.
Yes. Are you able to hear me?
Yes.
Oh, okay. Sorry, I can't put on my video right now. Dr. Fernandez, I'm really just overtaken with the work that you're doing. Thank you for that. I am a fourth-year dissertation student at Texas Women's University, and my population is young adults aging out of foster care. So I'm working with a center in Houston that has an intake of the population. So the goal of my qualitative research is that I want to be able to increase the knowledge of this population, and for that knowledge to then go down into undergraduate nursing programs, because there's really a lack of nursing education surrounding the population of young adults aging out of foster care. Moving forward, other than increasing the education around the population, so nurses, who are usually the last line of defense before they enter into human trafficking, what other suggestions would you have between nursing education and research and legislation that would help the population?
Yeah, that's a big question that I don't know if I have the answer for, but we can chat at a different time.
Sure.
What I will say is that, and I may be biased because I used, again, like ethnographic critical approaches to my work, and not everyone
Sure.
that, and it's fair. But you know, like maybe a focus ethnography can get you going, but also I think for what you're trying to do, it sounds like a critical ethnography where you will have different perspectives to the same phenomenon, and then that's where you can sort of plan intentionally how you're going to have some sort of policy implications of your work.
Right.
So at least in Houston, we have a lot of places, nonprofits that provide services for victims and survivors of human trafficking. A lot of things that we have to learn, right? Because for instance, for the immigrant population, there's a little layer of complexity to human trafficking, but we do have a type of visa that's called a U visa or a T visa that people who have experienced violence have access to, and that's really important for us to be aware.
Okay.
I will say that I also partner with immigration attorneys. And so every participant in our research will always have a free immigration consultation to our partners with our immigration attorney partners. So that's something you also have to think about, like having immediate resources available to the participants. In this case, well, I work with immigrants, so it makes sense that I have an immigration attorney.
Right.
For different populations, it might be a different type of person, right?
Right. So far, I've done my feasibility study. I'm doing hermeneutical phenomenology and the lived experience. And I was a foster care child, so I'm in the Foster Care Alumni of America. Through them, I was able to get the email of Senator Cornyn's senior staff member, because Senator Cornyn is very active with foster care legislation. So from what the feasibility study showed is that there are some areas of the laws that are there to protect this population. They can be made a little stronger, because once these individuals enter the homelessness pipeline, most likely they will be trafficked. So it's catching them before they enter the homelessness pipeline. So I would love to be able to speak to you more at a later date.
Yeah, yeah. Feel free to send me an email and we can set up a time to meet.
Thank you, Dr. Fernandez. Thank you for your work.
Thank you.
Dr. Graff, do we have any other questions in the chat that we need to address?
Yes, there's actually Danielle Granderson. She says she cannot unmute because she's at work. She has a question
I'm
for
working on that one.
I'm sorry.
I'm typing a response to her.
Oh, are you? Okay.
Yeah.
Okay.
Unless people want to talk about it, but yeah, I'm working on
Yeah,
it.
the question was for all panelists. I'll go ahead and read it real quick. So, as a doctoral student using grounded theory methodology, her population is family caregivers in pediatric home health settings, and gatekeepers of this population are the home health agencies. I'm interested in the nurse caregiver partnership in this setting. Can you give any tips on getting buy-ins from the home health agency so I can access this population? I currently work in an agency, but I'd like to interview nurses and parents from other agencies to diversify my sample. So there, Dr. Bieber.
Yeah, and Jane, I think, put in a similar thing. Um, so I do health services research and qualitative health services research, and it's really important that when you are doing health services research is that when you are trying to access the point of service is that it can be there can be barriers to recruiting from the actual point of service. And part of that can be not just that the site is being a gatekeeper, but that actually you can run into some very challenging corporate policies or policies within the sites that can just make it, even if the individual staff at the site really want to participate and they understand that your study is very important, that they might be constrained. And so it's not, and I've run into this a lot. And so there's some things that you kind of have to take a beat and start to map out. And I'm a visual person, so and this can really help. This is where your panel or even like talking with people who really know the topic, or even brainstorming if you're working in home health yourself, brainstorming with existing your colleagues that are your work colleagues, etc. You think about all of the potential ways that a patient can get contact with home health, and think about those as potential recruitment avenues. And that it for pediatric population, that can be obviously the patient, but then the caregivers are really important. And it's the same thing, especially for older people. That can be a caregiver or the older person themselves. And so, like Jane mentioned, support groups, online forums, the snowball sampling. But for home health agencies, you want to think about the point of referral, because you could catch people before they get referral. So that could be primary care practices, acute care settings, even case managers, other points of referral that could really be able to capture those individuals before they would enter home health. And then you could, or they are people that go in and out of home health, so that you could capture them after they've been in home health and talk to them that way.
Jane, you had a comment too. Do you have a question, I think,
Oh,
or
I
response?
think it was well covered. Yeah.
Okay. Okay. And Lillian, you responded to the question about minoritized. Do you have other comments to make on that?
No, I think just kind of highlighting what I shared. I tend to use that language as opposed to saying minority, because minority sometimes puts the emphasis on the person as opposed to the systems, right? And especially when we're talking about the demographic diversity of the United States, some of these groups, it actually isn't even correct to say minority at this point, right? So just something to consider, especially, for example, here in South Florida, it's around 70% Hispanic or Latino identifying.
So the question, Maxine commented, the terms marginalized and minoritized were used in the same sentence. So that's your response. Thank you. Thank
Yeah.
you. Thank you. You guys have fabulous. Oh my God. Go ahead, Alasia. I'm
No,
sorry.
you're good. I just saw a hand raised. It looks like Maxine has an additional question. Go ahead, Maxine.
Yes, thank you very much. So I work a lot with individuals with sickle cell disease, and that's why my interest is piqued with the two terminologies. And this is an academic question for me. Does anybody have one thing that would differentiate the two terms? Because they kind of run parallel side by side. So I just wanted to know for my own instruction, is there anything that would be different in forgetting about the systematic and systemic problems, forgetting about putting people on the sideline, that sort of thing. What else might be something that would differentiate the use of the either or both terminologies? That's my question. Thank you.
Yeah, I think I've also heard it really used kind of interchangeably at times.
Mhm.
And so I'm not sure how
What were the
anyone
terms
from our
again?
panel using the term marginalized versus minoritized, and if there's a clear kind of distinction in defining what it would be termed marginalized versus minoritized.
No, I don't. From what I know, there's not. I know there's a push to use what Dr. Bravo was saying in terms of, naming it. I have a paper on the importance of language too, and I push to move away from saying vulnerable populations to populations made vulnerable, because then you can name it, right? So right now, I'm an immigrant, 2024, I didn't feel vulnerable, but right now I am. I feel vulnerable because of policy, right? So I am made vulnerable by, right? And then you can name what's making the people or your population vulnerable. But I think minoritized and marginalized are fine because that means that someone's doing something on the population or they are being impacted by something, and that's why that's the condition, right? But other than that, I don't know. There's sort of like a different difference, if that makes sense.
Thank you. All right. Anything else from the chat that we missed, Dr. Graff?
Well, there is another question, interestingly, and a response too, I think, from Jane. Julia asked, what advice would the panel have on how to build relationships with your community of interest when you move frequently? My spouse currently has a career where we move states every few years. I'm having a difficult time finding individuals to speak with me, but I'm new to this area. And then Jane had a comment too. Do you have other comments, Jane, to add to that?
Yeah, just a question, and I think Lillian's kind of thinking along the same lines, that you could, depending on sort of how locally situated your phenomenon of interest is, you could consider if building sort of a national advisory panel that could, yeah, really turn the frequent moves into a strength. And there are many, good ways to engage people virtually. And that would also sort of give you nice variation potentially, depending on what you study.
Yeah, I'll just add, I think it's been actually kind of a strength. So I work with young adults, and one of my current studies focuses on college students. So I think it's been great that I get to focus on different Hispanic and Latino populations across these three different states. So it's not like leaving one place and leaving all the work there, but kind of just building at each place. And I think that's increasingly important as we know, right? Sometimes postdocs really are just 2 years and then you have to leave that institution. So trying to figure out how you can make it a long-term sort of connection that you can build upon.
Can I say something? So That's really tough because I think about that all the time. And I know in nursing, it's, people move around and even outside of nursing, I think it's fine. But honestly, I can't see myself moving anywhere else right now because of, it's taken me 3 years to build my community partnerships and relationships. And I would say that I have a meaningful relationship. However, I do have partner mentors in other states. Um, where we collaborate. And so I may not have access to that community, but I have a colleague or a collaborator that does. And so that's only like a temporary fix, right? Like if I want to collect data from Boston, where my partner is, I could do that. And we've done it the other way around, where he wants data from Texas, like South Texas. And so he knows that I have access to the communities, and so I'm sort of like his gatekeeper in that sense. But if I were to move completely, I think that would only work, to begin with. But then I would have to do all the things that I'm currently doing here to build like a meaningful relationship. But if you're constantly moving, I'm not exactly sure how that would work. From a like practical way, right? Because I'm thinking about myself, visualizing myself doing that, and it's just would not be 100% feasible. I would have to do, a lot of work.
Maxine has a post, which is interesting, a comment. Creating community parallel to your service outreach was mentioned earlier. Outreach and service beyond what one is paid for is definitely a cementing factor for building community, which fits in with Eugenio. I'm sorry, I'm mispronouncing your name. I'm sorry. It's what you were saying earlier. Yeah. So.
Well, we are kind of winding down and coming up on time. So I wanted to present sort of a question for all of our panelists. And it's that wonderful question that, we always love to, I feel like you always get asked this one, right? Like, give us one point or one aspect that you feel is most important to you about qualitative work. So an aspect or a point, something that you feel is really important related to qualitative research that we should take home with us. And we'll just open it up and kind of give you guys a second to think about that. But yeah.
That wasn't on the list of questions.
No, it wasn't.
Okay, good. I thought I was like
blindsided, yeah.
So I have an idea. So I think you have to go in with flexibility, and I talk about this with students all the time and my team and colleagues. It's like if you go in with the recipe or that you're going to follow the methods paper or the textbook, it's not going to work that way, right? It's great to have a guide, and you obviously have your protocol, and you're going to approach things the way that you're going to approach them. But that's, and you have to have rigor, and you always have to have sound research. But I think there is a level of flexibility, and that is why you always have to document everything that you're doing to maintain that rigor of the research. And I think that is something that brings a lot of angst, and it can kind of keep you up if things are not going the way that you want it to. And please know that even those of us who do it a lot are still having that angst and are still awake trying to figure it out.
I like that flexibility.
I can go next. My takeaway would be that this is deeply relational work. We've talked a lot about relationships with advisors, partners, participants. There's also our relationships with our colleagues. There's our relationships with ourselves. And I think, trust is a big topic in healthcare and research right now. And I think that is important in all of those relationships. So, bi-directional trust in your relationships with people that you're working with yourself to sort of make some of these decisions. And I think that's, picking up on Anna's point about rigor, I think that's how we maintain rigor in the work. And it's also how we sort of get the joy that's sustaining. And so, I think really cultivating those relationships on all the different levels that they exist.
I don't know if this exactly answers your question, Elijah, but it's something that came up in one of the courses I was teaching today with my PhD students. We were talking about like the value and how to market your value as a nurse scientist, right? Where a bit of a younger doctoral profession compared to others, and quantifying that to people outside of our field can sometimes, be tough. I see some head nodding, right? Um, so I was talking about my experience as in an interdisciplinary postdoc at UCLA. It was like 8 physicians and 2 nurses, but they market it as interdisciplinary. But in my collaborations with people outside of my field, physicians and clinical psychologists, um, it dawned on me that I had spent all this time like trying to build up my quant skills as a PhD student. And when collaborators outside of our discipline, when we were all working together on teams, I think what was really highlighted and shined as my strength was the qualitative skill sets that we bring as nurse scientists. So feel really proud of the qualitative skill sets that you're learning in your PhD programs, for those who are students, and also for those who are, early career. Um, I think that's one of the things that I've really been leaning into, and I've been kind of embracing it more in a lot of my work. For example, I'm currently adapting an intervention, and we're doing theater testing. And with the theater testing of the current EBI, we also are doing like mini sort of, I don't want to say makeshift, but they're not exactly focus groups, but we're trying to get reactions, not just take surveys of, what you liked, what you didn't, because that's really where the depth is. So that's like to answer your first question. I think that qualitative work just provides a depth. And sometimes, like, you can come up with the most perfect research questions, and they won't answer any of that. What they'll give you instead is actually even better, sometimes than what you were looking for. So I think with qual work, that flexibility that Dr. Bieber shared too, is one of the strengths.
Last one. Yeah. Okay. So I think I gain a lot of joy from qualitative work when I'm able to amplify participants' voices, because I'm all about stories and the importance of people's stories. But again, I think it's very difficult to sort of share a single story. So my job, our job is very difficult in the sense of how do you take individual stories and create one story out of that? I think that's a big challenge, and I think that's where our training comes in. But it does make me very happy when I'm able to stand in front of different audiences, whether it's my colleagues or students or policymakers, and able to share that one story as a collective and see multiple stories being reflected in that one story. So it is a lot of work, it's a lot of pressure, and it's a huge obligation. And I don't know if I want to say that qualitative researchers, but for sure, critical qualitative researchers is not just about the data or the stories, but it's really a commitment to social justice. And again, I think that's perhaps more true to critical qualitative researchers than qualitative research in general, because I know a lot of folks don't use those particular methods. But I think that's probably one of my biggest highlights of doing this work.
Thank you so much. So any final thoughts from our qualitative RIIG individuals who are asking questions? Any last takeaways or final thoughts from you all? I want to give you an opportunity as well.
Alasia, I'd just like to read Unique Layler's comment in response to Lillian. She says, thank you for that. When your comments, Lillian, I'm the only one in my cohort doing qual, and faculty always say, don't think what you're doing is not important because it's not quant. I've never thought about this, but I definitely feel like I have to do a lot of additional work because the education in qual is lacking.
Yeah, no, I think with like primary data collection, especially too, sometimes there's just a lot of uncertainty as a PhD student, but I think it's a great skill set to get in your doctoral education. So keep going. And a little plug for a great resource for anyone wanting to like up their qual game. The UNC Odom Institute does the research talk. I think, yeah, everyone knows about it, but I always take a class or two every summer because I think that's a skill set that always has to be refined. And there's always new advances. So definitely a great resource to check out.
Thank you so much.
And speaking of resources, if any of our other panelists have great resources for building your qualitative skills, or maybe delving a little bit deeper into what does critical qualitative work look like? If you have resources along those lines, please feel free to share them with myself or with Dauncey, and we're gonna try and make sure that everyone who attended our webinar is able to access those resources as well. Dauncey, do you have any ending thoughts or closing thoughts? Dauncey is our RIIG chair, so I just wanted to check in with you before we close things out.
Thank you so much. I think it is a great opportunity to discuss qualitative, and that's the whole idea of this RIIG, is to promote qualitative research. And I'm seeing a lot of interest in qualitative research, and you guys asked the right question, and I'm, really happy to see this interest in qualitative research.
Well, a huge thank you to our panelists. I really appreciate you taking the time to be with us and to share your expertise and your insights. It's been lovely to have just kind of a less formal fireside chat to just talk and dialogue about work and the questions kind of that we're having, and be able to brainstorm together and think critically about about the work we're doing, the value of the work that we're doing, the importance of it, and as so many of you have attested to, recognizing that our work goes beyond just data collection and reporting of findings, right? It really does, and it's important that we I think that we tap into that and remember that in what we're doing, and that includes all of our doctoral students who have joined us too. Like that, your work is critical and important, and so keep it up. And I hope that you all will join us again for future webinars. Feel free to reach out to myself or Dauncey if you have additional questions, and we can try and pass that information along to our panelists as well. And thank you again so much for being here. We appreciate you all. Have a lovely evening.
Thank you.
I think we have a few more to log off.
There are really good resources in chat. I mean, there was a CDC resource that from Dr. Bieber I didn't mention, but there's great resources there. So,
Yeah, thank you. Actually, we'll make sure to let me copy those before.
Yeah. So this institute that you're talking about, Autumn UNC.
yeah, that's a great institute. Oh my goodness.
It's amazing. I am there all the time.
Yeah,
I've never
yeah.
heard of it. I found it online. I dropped the link in the chat for everybody else, but I've never heard of that one.
Okay.
Yeah, they're great. They have a summer institute that's like a qualitative intensive summer institute, and then they offer like different qualitative courses kind of virtually as well throughout the year, but it's a really cool resource.
I took a little debriefing. We still have people.
Are you able, whoever has control of the meeting, are you able to?
I don't know if there's a way to ask people.
Because they may have walked away from their
I-
phone.
Yeah.
I can remove them.
Oh, we can put them
Okay.
in the waiting room. Yeah. Or remove. There you go. You know.
Okay. Oops. What is that? Waiting room.
Nancy, I discovered the Odom Institute through ICPSR, which is out of University of Michigan. ICPSR sponsors quantitative research big time. And then they have a few qualitative institutes and courses. And it was there. I was looking through things like all these, incredible quantitative approaches to data. And I saw qualitative and I went, oh, I'm going there. So I've been there 3 times, I guess. It's wonderful. It's absolutely wonderful. Yeah.
So good job, group. Wonderful.
Yay!
Alicia, a lot of work. Congratulations.
Thank you
Well
all
done.
for
You are a pro
making it happen. Everybody worked hard on this. Thank
You're
you.
so organized, your thoughts. I get anxious. So you're the perfect person for doing this.
We were ready. We could have gone another hour. We were ready. That was
I
great.
know. I mean, I thought the same thing. I was like, oh, we have so many great questions still to ask.
I know.
But I'm
Yeah.
glad that the audience started to
Yes.
engage and had some questions and brought those
Yeah,
forward. I was
wonderful.
really hoping.
Look at the work they're doing, it's
Mhm.
awesome work.
Yeah, it really
Wonderful.
is.
We had 48 according to
Yes.
my the 48 was, they said 122 people actually registered, and some of them are registering because they want to get the video of the recording,
Oh, yeah. I can see that.
Yeah, because I don't think they will get
Well,
a
that
video
makes
recording if they don't register.
Yeah, that makes sense.
Mhm. Yeah, so awesome work. Good job. We did it like in a short time, right? I was worried. Remember last time when we met, we were not even sure whether this was going to happen today.
I know. I was really worried that there just wasn't enough time for people to register, and yet I think we had a great turnout. So I'm so excited that it worked out okay.
Yeah, the chat was on fire. Like it was.
Yes.
Yeah.
I've
Yeah.
seen so many where nobody says anything. This chat was
Yes.
moving. People had great questions and great feedback.
Yeah.
I like that there were questions that we as a group, right? Like all these people interested in qualitative work, we couldn't answer the question about marginalized and minoritized. It wasn't really clear. I love that we all left with, things that we don't know. It's not settled. There's so much more out there.
Yeah.
It's great.
And if you look at this, like this is how I felt as a new qualitative researcher. Like I had feel like little support. And that's what you're seeing here too. Like people are asking, like, do not think that qualitative research is any less than quantitative research. I mean, it is much harder to do qualitative research if you think about it. You're not just collecting data, you are with the participant. Like what Higinio was talking about. He lived with those participants.
Yeah.
A lot of people think that way too. that, you know, that qualitative research is not that challenging, but it is very much so.
Very challenging. Right?
Very.
You need to have a heart for it. You need to have a
Yeah.
passion for it to do it.
Yeah.
And
Yeah.
I'm proud to see nurses doing that type of work. I feel like qualitative, the things I stumble upon anyway, come from social work or come from anthropology. I love to see nurses, like one of the participants said, nurses are like the last people that these patients generally see before they, take a turn, before they go into